My name's Katie Barker. I'm one of the consultants in obstetrics and gynaecology, and I'm one of the faces you might see in the hospitals in the Trust. I'm here to talk to you today about investigations that you might want to consider having if you've lost a baby recently. The reason that you might want to consider this is because when you've lost your baby, you might want to find out why it happened and if there's anything that you can do differently in future pregnancies to try and prevent the same thing happening again. It might, however, be that you just want to put this time of your life behind you and you just want to move on and kind of not opt to have any of these investigations, but that decision is entirely up to you. But what we like to do is to make sure that you're aware of all the options available to you and you can make an informed decision based on that. There are lots of investigations that can be performed and depending on how many weeks you were into the pregnancy or the situation or what happens around about the time of your baby's death can affect what investigations you have available to you or what you opt to have. We'll start with the investigations that we sometimes do before your baby's born, and this can be along the lines of infection screens. Now, this can be in the form of swabs or it can be in the form of blood tests, and it can include things like that you've already been tested for in the pregnancy, like hepatitis or HIV, but it can also look at other infections and things like parvovirus, which is slap cheek, or cytomegalovirus, which is an infection which is similar to the common cold, but that can have quite significant effects on the baby's well-being during the pregnancy if you do get it during that time. There's a whole host of different viruses that we can screen for, and we'll go through these in more detail with you if and when you opt to discuss or have these. Another test that we can offer, and normally we give you some information about this before your baby's been born, but we will discuss it in full once your baby's delivered. And this test is called Cytogenetics, which is a test which is done over at the Centre for Life, and in fact it can be done from any babies born after 13 weeks into the pregnancy. Now, cytogenetics is all to do with the chromosomes of your baby and what they inherit from his or her parents. All cells in the human body except for the egg and the sperm usually contain 46 chromosomes, and these are arranged in pairs of 23 different pairs. One chromosome in each pair is inherited from the mother and one is inherited from the father. And there's actually quite a big number of syndromes caused by chromosome abnormalities, and quite a lot of these can cause miscarriage, stillbirth or neonatal death. And the role of the cytogenetic analysis is to determine if the cause of the death has been from a chromosome abnormality. Now, with the way that this test is carried out can be in a number of different ways. So there's different samples that we can take in order to kind of have this analysis, and this would be done by a little sample of the placental tissue or a little sample of the skin and muscle from the baby's leg. And you can opt to have one or both of these samples taken. The benefit of taking both the samples is that if you just take it from one area, there's a chance that there might be what we call a mosaic abnormality, and this is just an abnormality that occurs in one area. But if you have the chromosome abnormality present in both places, it would show that there was a kind of chromosome abnormality throughout the baby and the placenta as a whole, and again would probably give us a bit more information than just having the one sample on its own. But again, as I said, you don't have to go for either option, or you can go for one or both options. With the cytogenetic testing, we do need to obtain consent for this, and we usually obtain the consent from both parents. So the final investigation that I wanted to talk about today is a post-mortem, which is sometimes known as an autopsy, and it's described as an examination of your baby's body after death. Alongside the placental analysis and the cytogenetic analysis, it can really help to provide vital information. It can kind of give us information about any existing clinical diagnosis that might be present in your baby. It can identify any conditions which we might not have already known about from previous scans or tests that have been done in the pregnancy. It can exclude possible factors such as malformations, infections, or the baby being growth restricted. And if the baby died before birth, it can give us an approximate indication of when your baby died. For some families, it can help them to resolve specific questions, and it can help them to come to terms with what happened as well. In the case of there being a genetic disease, a post-mortem can also indicate the need for other members of the family to be offered investigations. The post-mortem in itself can be different, to be done to a different extent, so you'd have different options available to you. So the very basic type of post-mortem can just be an external post-mortem, and this is just looking at the outside of your baby and sometimes involving some x-rays as well to have a look at the bone structure of your baby. The other two options are done in a bit more depth, and they're called a full post-mortem or a limited post-mortem. Now, a full post-mortem would be looking at all the internal structures of your baby, and a limited post-mortem would be looking at specific internal structures of your baby as well. And if you wanted to opt for the limited post-mortem, you could specifically say which areas of your baby you would like to have the detailed analysis in. Post-mortems in themselves only take probably up to 48 to 72 hours to do and to be complete. But I guess the time-consuming part with this is getting the results of the post-mortem, and it can take up to 3 to 6 months to get these results back. And the reason for that is that when a post-mortem is completed, very little samples of tissue are taken, and these are put onto slides, and it's the analysis of these slides that take the time for the analysis. So although having a post-mortem isn't going to delay you having any funerals, it can take quite a long time to get the full results back. If you opt to have a post-mortem, your baby goes from being in the mortuary here and is actually transferred across to the mortuary team at the RVI, and the baby's transferred by funeral car. Once the post-mortem's taken place, your baby's returned to our mortuary in the hospital at INSEC, and as I mentioned earlier, this usually takes about 48 to 72 hours. Your baby's looked after by the mortuary technicians at both our hospital and across at the RVI, and when your baby returns to us, the maternity staff are contacted and will let you know and help to move forward with your funeral arrangements at that point. If you wish to see your baby prior to the funeral and after the post-mortem, then that is absolutely fine for you to do that, and we can organise for that to happen.